started your presentation by saying the segue, and I wondered if you could draw the the dots between what you heard today and then your presentation. Is there a line connection of dots?
Well, sure. I think what you heard today was a number of speakers talking about the problem of extreme prematurity and how we really haven't solved those problems, and particularly the respiratory talk on bronchopulmonary dysplasia and the neurologic development talks that demonstrate that even the premature infants that do well have abnormalities in neurologic development that last for years and years. And so all of that leads you to the conclusion that we really need to do something different. All of the technology that's been applied to the extreme premature hasn't improved on those parameters. And I think it's an issue of reaching sort of the limits of development that can be supported by non-physiologic sorts of interventions.
And what do you think that's going to be? Part of your speech was about the future. And what do you think that's going to be, thinking outside this sort of box of where we've been, why you're saying, as I hear it, that we're sort of stalled at a plateau? What's going to propel it forward? Is it money? Is it new technology? Is it big data? Is it all of the above?
Well, I think there are going to be limits, right? I mean, there are certainly limits to what you can or want to do with technology. And for instance, what we're proposing, which is to continue a physiologic support system outside the womb for the extreme premature infant, in my mind at least, isn't designed to take the limits of viability even further back. I think as you do that, you'll discover new problems and new issues related to artificial support. So the current goals, and what I think from a bias perspective, at least one thing that will move the field forward is to put the fetus in an environment that is a normal developmental environment. And fluid surrounding the fetus has a tremendous influence on lung development and just preventing the iatrogenic injury that occurs with current methods of support outside the womb. I think will at least improve upon the current severe morbidity and mortality. So I think the key is to return to normal physiology as much as you possibly can.
Where would you say that we are in understanding the placenta? You talked a large part about the artificial placenta. And where are we in the presentation before yours today was about the placenta, and think of the placenta in new ways. Right. What do you think that we don't yet understand about it, and the lack of knowledge?
Well, I think there are many controversies about the placenta in terms of what the placenta does for fetal support versus what's provided by the mother. So there are some of those controversies that we don't really understand in terms of growth factor production and hormonal production and those kinds of things. I think a huge area that we don't really understand are the epigenetic types of developmental occurrences that are normal versus what occurs in the preterm infant that's separated from the mother and the placenta. So one of the things that I think will be very interesting in terms of development of the artificial placenta is if you prevent some of that epigenetic change that can imprint the fetus for future diseases. And there was a fair amount of discussion about that today as well, that almost anything that you do can have long-term consequences in terms of adult disease, growth, all those things.
What are the things that you most marvel at, the achievements that we've seen in the last 3-5 years that surprised you the most or you most marvel at?
Well, I think it's a difficult question because, as I said, I think we're a little bit stalled out.
Yeah.
I think the achievements I marvel at is just the information that we're generating, and that information at the present time is overwhelming. And the real accomplishment will be to figure out how to use that data to achieve human benefit, therapeutic benefit. So you heard a huge amount today about genetic analysis and precision medicine and applying genetic tools to understand what treatment to give when to what individual. And that's still very primitive, but I think the tools are being developed at an amazing rate, and ultimately I think it'll pay off.
I asked one of the speakers, and she said that I'm here is one of the things that I most marvel at, with all the complexities, with all the dysfunction, with all the potential for catastrophe
Right.
that the human
Well, I've said
being
that for many
exists.
years, and when parents ask me, why does my child have this? Because I deal with a lot of congenital anomalies, and I always say, development is so complex that it's amazing that we all turn out relatively normal, and it's becoming more and more evident that there really is no normality, right? We all have genetic abnormalities of one type or another, or variability, I should say, that predisposes you to one thing or another, and so it's amazing that we're all walking around relatively disease-free. But development's an amazing thing. We're learning.
What does a
Great deal about it.
conference like this expose you to, and what do you hope to expose other researchers to?
I think a conference like this just broadens your horizons. It makes you realize, what other people are doing that's cutting edge. And a great deal of the information you heard today wasn't published, right? So there's nowhere that you can access that information or hear about it unless you attend a conference like this. And so, and also this conference is intended to provide a vision, right? Not to predict the future, but to give you a hint at what the future may hold. And I think that's the really interesting part of it, to hear spectacular people talk about their vision for what the future might hold.
Hey, what's your passion? What drives your passion? What fuels it?
Well, I'm a surgeon, okay, and I'm specifically a pediatric surgeon that got involved in fetal therapy very early in its development with Mike Harrison at UCSF 30 years ago. And so treatment of the fetus, treatment of humans before birth has always fascinated me and has always been my passion, and ranging from surgical repair to stem cell and gene therapy to now the artificial placenta. There's no question that's continued to drive my scientific interest and desire to contribute.
A word that was used here many times in many presentations, inflammation, and then metabolism. And can you connect those dots, or are they connectable dots, or take each one?
Well, as I said, I'm a surgeon.
Right.
So connecting those kinds of dots is a little difficult, but actually the presentation about that was from a surgeon,
Right,
Carl Silvestri.
exactly.
But he's got a much better handle on those metabolic pathways than I do. But no, I think it's perfectly conceivable that, for instance, metabolic changes can impact the immune system, and that may lead to a propensity to either inflammatory reaction or susceptibility to infection, or both. And so everything starts with metabolism, altered metabolism, whether it's cause or effect, and it cascades from that point. So it's certainly not surprising to think that they're connected. Question's always which came first, as he raised. You certainly get metabolic alteration from inflammation, and you can potentially get inflammation from metabolic alterations. But that's about as good as I can do on that question.
Great. Thanks a lot.
All right, yeah, you're
Appreciate
welcome.
it.